So I just want to welcome you all to this important subject, and to also just make the request that all my guides, my lineage, my teachers who are with me throughout my teaching today be with me, and that it will help to benefit you and those that you serve as you do this important work. So death and dying is it's an interesting subject according to Tibetan medicine. So actually, if you look inside the Gyushi, which is the 4 tantras of Tibetan medicine, there are some very specific instructions that are given to Tibetan doctors about managing terminal illness. One of the first ones that surprises a lot of people is that it's said that we should not take on the treatment of terminally ill patients. So when I first started studying this several decades ago, I thought, well, that's really weird. And I didn't really understand what the purpose of that was. And the purpose of that was twofold, really. The Tibetan doctor is considered an emanation of the medicine Buddha when they're in actual practice. So this isn't like an imagined kind of, most of us are Buddhists, so we understand that we actually have the transmissions, we have the deity blessings within us. And so they really want to promote this sort of stainless aspect of the healer or the medicine Buddha. And so for that reason, there's not a lot of attention giving to someone that we know is going to die. Instead, what we do is we turn our minds towards the Dharma, and we provide teachings about how to prepare oneself, how to ready the mind, how to ready the body, what to expect, and those sorts of things. So one of my first terminal patients as a Tibetan doctor was when I was living in Darjeeling, and we were going to the home to monitor the progress of a woman who was dying from hepatitis that had turned into liver cancer. And so I remember wanting to go to her funeral, and my husband basically told me, no, I shouldn't go, because it was important for me to sort of be more in tune with the life process as a doctor. And that also was really hard for me to understand. And then over the course of my time as a physician, I've kind of grown to understand the real important need that terminally ill patients have for having time and attention and being really prepared. And sometimes it's about the preparation for the family. So there's actually much more instructions about how to prepare the family, especially if the patient isn't really accepting the death, if they're very resistant to the death. And there are a lot of reasons for that, and I will go through those today. So I can say with utter certainty, having experienced a lot of death of patients and close people that I've loved, that it's a very powerful and spiritual potential for awakening your own bodhicitta and really empowering the seed of compassion that's inside you. It's hard because we cannot actually eliminate the seed of suffering, which is dying. And we know that the Buddha taught the 4 Noble Truths, and that if we're lucky, we get the suffering of old age, but that's not always the case. And so being able to cultivate that bodhicitta in the present moment with your patients or with those that you're helping in the dying process is something that's really understated, I think, and of primary importance. So I've developed some slides to show you. I'm going to take you through them. So I just need to share my screen here. And then I have to hit play somehow. There we go. And then give me just a second so I can minimize. So there's some aspects that we need to cultivate when we are facing the transition of death for ourselves or for loved ones. So compassion being the first one, that bodhicitta that I talked about. We have to cultivate fearless confidence. Fearless confidence that we have to walk through this gate. And the best way to do that is knowing the bodily process and understanding interdependence and individuation. And now I've got to figure out how to advance this screen. Okay, there we go. I think it's okay. So compassion, the Buddhist perspective. So it's not just having this idea of pity. Sometimes in Tibetan, we'll hear the word like ningje, which means compassion. But sometimes when you're having a conversation about difficult situations, you'll hear people say sort of ningje, which means like tisk, like, oh, that's so hard. But this isn't really that type of compassion, nor is it the type of compassion where, you know, we just feel sorry for someone. It's really understanding that we're in this same boat of samsara together, and that this person is experiencing real feelings, real tragedy. And so there's really no way that we can fix it. There's no way we can change the situation. We can't actually eliminate the inevitability of death. And so recognizing this is part of understanding that Four Noble Truths that the Buddha taught. And to cultivate this idea of fearlessness in a normal physiological process, we have to understand what that process is. We have to understand that everyone is facing this gateway sooner or later, you know, the expression of nobody gets out of here alive. And so for that reason, we have to understand, so what is it to have death occur? What does part of us is actually deathless? And how do we cultivate the compassion to sort of allow that deathless part of our consciousness to free itself from this sort of temporary house that we have? So one of my Kempo friends gave me some advice early on when I had a patient that was really struggling with their diagnosis and didn't want to leave their young children. And so we were trying to explain to her that you have a temporary house and basically you're moving house, and everybody's going to have to move house. And the karmic thread that you have throughout your lifetimes, you will still interact with your children at some point in some way. And so that really helped bring some comfort to that particular patient. And I think it's really, really important. People will get Bardo teachings and people will understand how the elements dissolve from a sort of technical point of view. But first, you have to understand what's the pathophysiology of the body from a Tibetan perspective. How do we even attain this temporary home that is a body? And it all comes down to those pesky 3 root poisons. Of course, the main root poison is ignorance, this unknowingness, this lack of interdependent connection to all phenomena, realizing that we humans are all the same. We get very attached to our projections of this sense of self. But long before that begins, we have to have a formation of the body in the first place. And so what really happens is we have this base level of ignorance causing separation, and it's propelled through our own karmic propensity. It's heading us towards incarnating into a body. We see that there's an open womb, and then we have some kind of karmic thread or connection, which is sort of flinging us forward. And out of that arises the 3 root poisons. Of course, most of us are very familiar with them: desire or grasping, aggression and anger, and ignorance. So these 3 root poisons have to commingle with the 5 elements and our own karmic propensity to create what's known as the 3 faults. So sometimes people will translate this as humors, like you'll see humor in Ayurvedic medicine, or you'll see sometimes it called basic nature. A lot of times people will be much more familiar with them from the Ayurvedic point of view than the Tibetan. But in Tibetan, we have desire or grasping, which I often say is kind of like golem, you know, my precious, I want it, I need it. Yeah, it's that kind of clinging, which gives rise to the lung, or the wind element in the body. And we have 5 lung, in the pathophysiology of the body. I always use it as the first example because, of course, it has the life-sustaining wind, which goes from the crown of your head all the way down to the 4 finger links beneath your navel. And so when we're doing POA practice, for example, we're very familiar with working with that particular wind. If we're working with Salung, for example, we're very familiar with working with the all-pervasive wind, which has us moving all of our limbs. And so disorders relating to Parkinson's, MS, neurological type situations are very much related to wind. We also have really that kind of uneasy feeling is quite related to wind. And you see, especially in elderly people who are nearing the end of their life, we're in the wind stage of one's life at that time. And so when death approaches, sometimes the wind is so strong that that sort of intense grasping of the body and grasping on can really overtake people. And so it is very difficult for them to surrender into letting go of this temporary body, because the wind nature is so high and the anxiety about the unknown can be so high for certain individuals that it's really hard for them to let go. And so for that reason, we apply specific antidotes that calm down the wind during that time. And I'll talk a little bit about that. So the aggression or the anger is, of course, associated with bile. You see this a lot more with blood conditions and very hot-natured disorders. So if someone has, for example, endometriosis, or maybe it's a skin condition like leprosy is an example, or it can even be as simple as psoriasis, chronic sinus infections, really bad fevers. Some conditions within COVID were very much related to fire. When you saw that there was a lot of high fever in that early wave of COVID, there was a lot of like heat that would go into the lungs and rise and dry out the lungs so that people couldn't breathe, kind of thing. So the fire nature is very hot and aggressive and sharp, and it kind of attacks. And so when this is in an excessive amount, you might see a dying person be very aggravated and agitated at the time that they're nearing the end of their life. There's a lot of resistance. There's a lot of anger. There might be some arguments. You know, that kind of discord that can happen in families sometimes can really set this off even more. And you will see mirrors of the root poisons within family dynamics as well. And so it's important as a caretaker to just notice that and see if you can apply the correct antidote to that aggression root poison, which is, of course, more generosity and a lot of metta. So metta is the ultimate antidote for the root poison of aggression. And also practices such as chud can be really helpful, unless the person has not learned to seat their mind properly. I find that a lot of times Western people really want to gravitate to these kind of bell and whistle kind of practices, these really high-level tantric practices. But if we all remember the story of the Tibetan woman who prayed to the tooth of a dog that her son brought home and said it was a tooth of the Buddha, that kind of devotion and simple, like really Om Mani Padme Hum, illiterate, you know, old Tibetan people, they also have every bit as much of an enlightenment as people who can do really high practices. It's all about the motivation. And so sometimes I think it's really important, particularly with people who gravitate towards that aggression as a root poison of I must know it all and I'm the best and I'm a great practitioner and all of that sort of thing, that we just really need to kind of make it quiet and soft and kind of cool things down. So our friend ignorance, of course, creates more ignorance. We don't have to go very far in our culture, society, world, humanity to realize that this is so. And so this type of situation is sometimes when you see, I have a terminally ill person right now who is a musician and is stage 4 in the bones, and they are really resisting the rest that they need to sort of expand their time. They have the potential to expand their time, but they're pushing themselves so hard in the ignoring of the actual terminal diagnosis and overworking and going to gigs like night after night after night, and sort of using up all of that excess earth and water because they have a basic nature of more ignorance, more excess. Or you'll see this with the people who are dying of lung cancer and they've got their oxygen on and they're outside smoking, right? So they're just like, I'm going to ignore this. And partly we're like, okay, well, you know, if you're going to die from this and you really want your cigarette, then that's a little bit of like desire and grasping and ignorance kind of co-emerging, but you kind of get what I'm saying here. So we have these root poisons and then they mingle with these 5 elements. So we have all of them, right? So we have all of them. None of them are great. None of one is better than the other, but we have specific times in our lives also that these express themselves. So childhood is more pagan, or it's sometimes translated as phlegm. I really hate that translation, but it's kind of the best we can do. This is the heavy body. This is like, for example, someone who is dying with a lot of edema in their body. They have a lot of excess of earth and water from their disease. A child will have more earth and water during that time because it's more dominant. Hormones kind of kick in and we start our fire time and we, you know, make careers and have families and we produce and we do all of this sort of upward rising fire kind of activity in the middle of our lives. And so you'll see more heat disorders kind of in the midlife kind of get people. And then towards the end of the life, you see a lot more intensity with the wind element. People's skin gets thinner, their bones get lighter, their appetite gets thinner. So you see more of that air or that wind. So we have them all. We have all 5 of them, and they mingle together, but they create this pathophysiology. So how do we move from this formless state into form? So like I said, we're this temporary house, and it's really the union of the body and the consciousness. To even obtain it, we have to have all 5 elements in the correct proportions. So when we have, for example, deafness, muteness, or some kind of deformity, then some of those 5 elements were not in the right proportions, perhaps. And so all of that is commingled with our karma that is just leading us on this pathway towards having a body. So we have some pretty important factors of the elements that you need to know. So how do they interact with the mind body? How do they interact within our own personal makeup? And when we begin to understand that, we understand this concept of this temporary state of homeostasis. And then that homeostasis always gets disturbed because, as the Buddha taught, nothing is permanent. Everything is subject to change. There's going to be birth. There's going to be, you know, sickness. There's going to be old age if we're lucky, and we're all going to have death. So that homeostasis state is a state of flux within the Tibetan medical system, where we're always trying to understand what balance is. And you can still have great balance in a terminal illness or treating a terminally ill patient. So for example, when my father was dying from pancreatic cancer, and there are 3 types of pancreatic cancer. He had the worst of the worst, which is adenoma. And usually it's like they find it and you're dead within 6 weeks. And he made it 5.5 months. And some of that was because I recognized that he had a fire-natured disorder. And so I treated that very directly to try and maintain as much homeostasis throughout the dying process as possible. And so if you can match the disease with the state of the person, and I'm going to kind of unpack that a little bit today, then that can help them feel more balanced in the process within their body, mind, spirit, as they're headed into the direction of the great unknown. So knowing that we're composed of these 5 elements, and these are considered flawless seeds, which are derived from our parents. If they are slightly flawed, we can have birth defects and those sorts of things. And that's sort of also considered karmic. But we're sustained throughout our life, but we're also afflicted by these same elements because they can either be imbalanced or agitated, or they can completely exhaust themselves. So for example, in the West, we're very heavily predominance of wind disorders. So sometimes when I'm ordering medicine, my Tibetan doctor pharmacist friends are like, what is happening over there? Like, all you order is wind medicine all the time. And I'm like, land of lung, because we're so taught from an early age to grasp onto things, to have that kind of grasping. And this really follows us throughout our whole life. And so it's really important to understand how the mental factor, according to the Buddhist point of view, can actually influence the physical body. So for example, just this week, I had a patient who was perfectly well, who I read the pulse, who had a situation going on, and one particular organ was really not in line with everybody else. And I was like, listen, this is absolutely a physical experience you're having, but this is coming from a place within your mind where you're not actually allowing yourself to be who you are. And I kind of listed a bunch of things, and they were like, yes, yes, yes. And I was like, okay, you need to work with that. You have to work with the mind state in order to bring back the best balance you can, so that you have equal proportions of that lung, equal proportions of that tipa, and equal proportions of that pagan for you, yourself, and who you are. Because everybody's going to have a little bit slightly different. And this is based off of our mental faculties, and particularly our predominated karmic habitual patterns that we come in with. Which is why if we think about Buddhist practice and we're trying to practice as much as we can in a lifetime, it's because we pick up our karmic patterns. They go with us. This is a kind of funny picture I have of like, where is my Uber driver taking me? Like, where am I going to go? But where you're going to go in that detached, formless state is still going to have imprints and seeds of those habitual mental factors. And so that's going to come into your life as you form, and it's going to help co-create where the dominance of the root poisons are going to be in your own body. And you cannot obtain enlightenment until you eliminate the root poisons. And the best example of this I have is I once asked the 17th Karmapa. I was living in India and I went to go see him, and I said, I have a really easy time with having compassion for the people that have no limbs, or, they have leprosy, or they have all this, but I'm having a really hard time having compassion for politicians in my own home country who are throwing bombs on people. And I remember this so vividly. And the Karmapa just looked at me in that piercing way that he does. And he said, well, you just have idiot compassion. And of course it was like, but it was the greatest teaching, because what he was saying was, unless I could eliminate my own root poisons, there was no use in trying to cultivate bodhicitta. So I cannot find true compassion as long as I'm having my own grasping, my own aggression, and my own ignorance. So to cultivate that compassion of how other people are suffering in their bodies, we also have to kind of enter their mind stream a little bit and understand how their own mental constructs are creating a disturbed state. What's making them more unhappy, and how can we work with that? And I think within a terminal illness diagnostic point of view, we really have to look at the family system, and we have to see how to support that person so that we can clear away as much of those root poisons as possible, so that the self-arising luminosity can make its way to the surface as the actual elements dissolve. So about the elements of the body, I'm sure that some of you have received these teachings, but the elements need to be understood from a Tibetan medical point of view according to their functional properties rather than like a literal point of view. When we talk about meditation, for example, or you look at a picture of the Buddha sitting on the base of the throne, so the Tibetan word for that is ten or tenpa, and the base provides the stability. So that's the earth, that's the solid base. So the earth provides a solid base for us. Water will impart the moisture and the fluidity. Fire bestows the heat and the ability to grow. And then the air lets things that are so subtle and unseen to move and then co-create with the other elements, while space provides really the potential or the possibility. So the way I describe space as omnipresent means that we have to have space in our interstitial fluid. We have to have space in our arteries. We have to have space in our spongy bone. We have to have space inside the uterus to even grow. So the elements really have these functional properties that allow us to move. So when we're first forming in our mother, we have to generate this embryonic body. We are this alien-like zygote, and our body fluids kind of emanate from the power of the water, commingling with the earth to have this kind of solid sort of lump. And then we need to have the fire element to help us to grow. Oftentimes in early pregnancy, when people miscarry, it's because there's not enough fire element in the mother to sustain the pregnancy. And so she's not able to send that fire element, which, if you know from certain Buddhist practices, lives about 4 finger lengths beneath the navel. And so that has to actually provide the warmth, and then the wind comes in and helps us through the cord to sort of receive this circulatory nutrients, oxygen, and all of this from our mother. And if we don't have enough space in the womb, or the space isn't correct, like if we have a tubal pregnancy, for example, then we can't actually grow. So there's a reliance and an interdependence on the form and the elements that happens, and it's all connected to those root poisons. So I'm just going to briefly review those. So again, earth is this cohesiveness. This is the base. It provides us to grow and to flourish. It's responsible for formation of muscles, bones, the sense of smell, and the nose. And you can see that very clearly as we watch Earth disappear. People lose their sense of smell, their bones become very fragile, they have muscle wasting, all of this. So this is the stability and the cohesiveness that Earth provides. And we have water, which is really all about our fluid and our moisture. And it's this lubricant that we need to kind of carry all of the other elements. In the Chinese system, for example, water is considered very much associated with fear and the nervous system. In Tibetan medicine, it's much more related to, allowing things to sort of form in terms of like sense of taste, body fluids, joints, like these kinds of things, the throat, sense of taste, all of that. So it's really required to help lubricate everything. Oftentimes for people who are having difficulties at the end of their life due to edema or pulmonary disorders, congestive heart failure, this type of thing, we will see an excess of water build up because it cannot move through the channels properly, partially because the wind isn't functioning. And so it just kind of gets bigger. Or if you have people with kidney disorders, for example, or renal impairment that's headed towards failure, there's this relationship with water and fire as it's dissolving, where sometimes water gets so extreme that the kidneys can't clear it. And so you'll see like bluishness on their face, which is very much associated also with wind. So fire, of course, is the circulation I discussed, providing warmth and the maturing and the ripening. This includes the ripening of disease as well. So any kind of heat-natured disorder is much more dangerous and fast in killing you than the earth and the water disorders are, because fire is so dangerous and fast and sharp and hot and cutting by its nature. And so blood disorders, for example, or like sepsis, for example, can be very quick and move very fast through the body. And that's because it ripens everything. So the disease will also ripen really quickly. And then this is where people might start to have really intense agitation. Like you'll notice that if people have high fevers, they'll sometimes be very agitated. And that's due to the fire element. And then we have to antidote that because, of course, it's related to that aggression. So we have to calm it down. Usually we talk about in normal medicine, like, spending time next to a river or something like that. So a cool cloth on the forehead, something of that nature, or wetting and moistening the lips can be very useful and helpful. I will never forget when my husband came. My grandmother was in a facility kind of in May of 2020. And of course, it was hard because I knew she had fallen, she had broken her hip and she stopped eating. And I knew she had early renal failure. And so I said, okay, she has 3 days. I'm packing my bag and I'm going because I'm going to be with her for the 3 days. And they said, oh, no, she'll have 5. I said, no, she'll have 3 days. So I went, and no one was allowed really in the facility, but I was like, I'm going in. So I had to sleep in there in a mask with the whole gear. And they would let, because she was dying, they would let one other person in. And my husband came in to help clean her up and get her ready. And he gave her a bath, and she was kind of in this fire situation. And she was a very fiery, aggressive woman anyway. And so I remember him, wiping her lips and, bathing her tongue and cleaning her all up. And then just very sweetly talking to her and saying, you're all ready now. You're good. You're clean, everything's good. And I just remember just really appreciating that moment of him bringing that fluidity back in when that fire was kind of drying it all up. And so you also notice the fire element as it's starting to dissolve, people's energy will draw in from their hands and from their feet particularly. And we have a death pulse that we'll listen to on the top of the foot. And you can tell that as well in allopathic medicine. They will do that to see sort of how long one might have. But essentially, we know that it starts to move into the body. Or for example, my father, I had the pulse ox on his finger, and I sat next to him all day working on my computer, and I just watched as the fire started to slowly dissolve. And it took a really long time for him because he had a fire disorder. He had pancreatic cancer that had spread to his liver and then moved everywhere. And he was a fire-natured person. So he had a lot of fire, and it took a very long time for it to dissolve. And as I watched the oxygen kind of go in towards the center of the body and the complexion and everything change, I could see the fire going out and was able to communicate with him about how long he had left based off of that. And the air element really assists in growth. It spreads and it hardens. When we're talking from a medical point of view, controlling wind, we're really talking about controlling our grasping and our desire, because it's almost in some ways, it's hard to say the most destructive, because of course ignorance is the most destructive because it breeds all 3 of the root poisons. But wind is really, sometimes when I lecture, I'll explain that wind is the thing that sits on our shoulder and goes, like, eat the chocolate, have the bad relationship, you're dying of lung cancer, go out and have your cigarette. It's like, it's that thing that kind of really spurs on that kind of grasping that doesn't really help us get in touch with our luminous being. But on a very pathophysiological level, wind is responsible for growing disease, hardening disease, and spreading disease. So if you have a terminal illness, if you cannot control the mind, and you cannot control the anxiety, and you cannot control the fear and the worry that comes with that, wind increases exponentially, and this spreads the disease much quicker. And so it's much harder to settle that person down. And so even though wind is going to aid in becoming more gross in a disease state from the subtle form, when we're dying, it goes the backwards way, where we're going from the gross into the subtle. And the wind into space happens very, very quickly, because we've sort of dissolved everything else. And so everything kind of that has come in has to go back out again. And so this is why you'll see when the wind starts to dissolve, and the tigle, which is that sort of life-sustaining energy that's held apart on the two ends of your central pole of your life channel, starts to move and get closer. That's when the death rattle begins. That's when you start to see that you're in an active death process. And so sometimes people will have a more apnea type breath, where people will just stop breathing for 30 seconds or more, or almost up to a minute sometimes. And so the breath and the circulation begins to have difficulties. So they won't have feeling or sensation in their legs. They won't necessarily, like, you'll feel parts of their body and it will be very cold, right? Because we've lost that heat, and now it's kind of on the really subtle level. Obviously, because it's responsible for skin sensation, speaking, and breathing, we're going to notice all of that at the time of death as it's approaching. And you could look at the dissolution of elements from a point of view, I would say, having sat bedside for a few people, of watching the nervous system really kind of have its last hurrah. When my cat was dying and he was 21, his last moment was a lot of twitching, because he was, I think, having a heart attack in that moment. But because he died of renal failure, and that will give you a heart attack. So, but I watched him go through this like air for days. I watched the dissolution in a minor level and a macro level. And I think it's really important when we look at these Buddhist teachings, where we're thinking like, oh, we just move into space really quickly. It's actually a process that we're moving into space. So this idea of space being omnipresent or all pervasive is really important, because we already have that space inside of us. And that's our luminous, interdependent, and interconnected nature. Our Buddha nature is already there. It's just veiled by those root poisons who have really intermingled with these elements in a way that we sometimes think about, like, okay, yes, this is dissolving and that's dissolving and that's dissolving. But it's more than that, because our whole life we spend time with these elements and really habitually co-creating a lot of tendency to sort of strengthen or reinforce these root poisons. And so when you're working with people, if you can identify what their basic nature is, it can help them move into space a lot easier, because space provides the sense of hearing. It's helpful for people who are dying to really provide a lot of reassurance. In my grandmother's case, she was very afraid. She really resisted. She really struggled. She couldn't speak. She had this moment of surge, like a surge day that everybody gets. And I knew it was her time and we only had a few hours. So I literally FaceTimed all of her children, all of her grandchildren, all of, her great-grandchildren that wanted to say goodbye to her. And she couldn't speak, but I knew she could hear them. And so that was really important. And it was very important for an estranged person, for her. I said, tell your mother you love her. Like, I know it's hard for you to say, just tell her, because she needed to hear that. And then I kept just very gently rubbing the top of her head and saying, it's time to let go. I'm right here with you. I'm not leaving your side, because she could hear me and I had promised her I would be there. I'm right here. I'm right next to you. You don't have to be afraid. And oftentimes that's very hard for family members to do, because some people are not quite ready to let their family member go. And so we, as like death doulas, have to actually support that family member in order to be able to let them back away from their own attachment to this person or this body or this person that we think that is only in this one form. We have to be able to let them go, and space actually helps provide that. So I'm going to pause there for a second and just ask, are there any questions about that so far?
There have been no questions so
far.
Questions.
Okay. So essentially, we can sustain the body. I have that one slide in there, but I'm going to move past it because for time purposes. We can sustain the body even through death through looking at nutrition. So we can really support. So essentially, we can sustain the body. I have that one slide in there, but I'm going to move past it because for time purposes. We can sustain the body even through death through looking at nutrition. So we can really support what's known as the 7 bodily sustainers, which goes all the way to the Tigli level. Of course, we have the destructible Tigli and we have the indestructible Tigli. And from a Tibetan medical point of view, we can strengthen the destructible Tigli, which is what sustains the winds, holding those 2 central points apart from the heart. And so that's a lot of what I spend my time doing all day long. And when you have someone in a terminal illness, you can still support that to the best of the ability by matching their characteristics of their disease and their mental state. So recognizing how these 3 faults interact. So I have here on the screen, you see this branch. This is the first branch on the allegory of health and disease. So this is the balanced homeostasis state. And you'll see the 5 winds, the 5 biles, and you'll see the 5 earth and waters, or the phlegms. And they have different locations in the body and different jobs that they do, but they really all boil down to passion, aggression, and ignorance. So if you really want to begin to understand passion, aggression, and ignorance in a physical form, we have to start to think about the characteristics of how these root poisons present on a psychological level. If you look at the center of this thangka, where you see the snake, the pig, and the crow, these are representing, of course, the 3 root poison and how they express in the body. And then to the right, you'll see those 3 central channels. They're not actually like this in the photo. When we do something called the 9 purification breathing practice, for example, for purposes of visualization, you will see it. You'll see it in other tantras a little bit differently. The 3rd Karmapa was actually a physician. A lot of people don't know this, but he has very important texts on the subtle body. And if you really want to understand how the elements dissolve and are formed, that's the best text to read. But when we see the importance of these elements as they express themselves as a root poison, we can start to have a little bit more confidence about where our pitfalls might be. And we can work on those if we're like preparing for our death now, which we all should be. We should really start to think about, like, what am I going to be more likely to do? Am I going to be more likely to be really angry about dying? Am I going to be more fearful and sort of uneasy and really attached to my human form? Or am I just going to sort of ignore it and not prepare myself to try and face the luminosity? Am I just going to allow this process to unfold without even preparing? So emotionally, we have to also recognize where a person is. And then also, I'm going to mention again the family system. It's really important. And back to the beginning of my talk, where I said that some of the family systems are really vital to understand. And as a Tibetan physician, sometimes you prepare the family more than you prepare the actual patient, because the patient has their own psychological process that they're trying to deal with. And so you need to prepare the outer family, saying, okay, I'm noticing a lot of anxiety. So let's work with that anxiety. So we're working with the lung energy, for example. The superior treatment for lung is massage. It also says that you should be in a warm, dark room with a good friend or a lover who talks sweetly to you. And that's what everybody that's facing that anxiety around letting go of their body needs. They need someone right next to them, reassuring them, just like I did my grandmother. It's time. Everybody does this. You're fine. Like, your job is done. Everybody loves you. In her case, I was saying grandpa's waiting. So we have to have a cultural, sort of context for this. And I'll never forget my other grandfather. I was getting ready to leave for, or I just returned. I was getting ready to leave for India, and I didn't know when I was going to be back. And so they were quite old, and I went to go visit them. And he said, the longer I live, the more I think you Buddhists might be right. And you got to keep in mind, he grew up like third generation, like Methodist minister child. And he said, so what can you tell me? And I said, put Jesus on your head and go there. Like, what was I supposed to say? I couldn't like shatter his belief system, but we can always say things that, like, I said, you're going to find this really bright light and there's going to be a lot of sounds. And when he broke his hip and he was going to have surgery, I said, Grandpa, I don't think you're going to make it through this surgery. And he said, yeah, I think you're probably right. Just remind me what I should do. And I said, put Jesus on your head and go there. Go to the brightest light you see, even if it's really loud and disturbing. Like, it's the best place for you to go. So don't be afraid. So we can encourage people to kind of understand this bodily process that they're going through and match it to their root poison to sort of see how to best help them sort of uncover the heaps that we have veiled over us. And if you can recognize what's happening for that person based off of their psychological form, you can apply the right antidote. So if someone's super aggressive, they're going to need to calm down that heat in their body somehow. So sometimes that's a cool cloth on the forehead. Sometimes we can, if they're still taking in, we can do like a cooling tea kind of thing. And also just really quiet reassurance and no arguing in the family. This is really important. That sort of a thing. And if somebody's really heavy in the ignorance, we really want to make sure that they have some very clear instructions on what to do as the process of death happens, because they're ignoring this whole process. And so it's going to happen and go by them. And then they're just going to kind of head into the bardo and be like, I don't know. Okay, I'll just go to that. Looks good. So it happens differently for everybody, but it's really always about the 3 root poisons. Again. Okay. I see what the problem is, but I can't get my cursor off. Okay, there we go. So matching the basic nature and the nature of the disease for the dying person is really important. So I can do that through the pulse, but you can also do that through looking at a person's habits, their habits of their mind and how they respond to things. And so you can match the nature of the disease that they're dying from with their basic nature. And you can see that if they have a nature of disease and a basic nature and it's matching, it's going to be very swift how quickly they decline. It'll be much more serious. And it's something where that root poison can arise much quicker, versus if they have a disease that is unmatching to their basic nature, then they can last for a very long time with a condition that's considered terminal. And so this actually allows them a lot of preparatory time. I have a person right now who has a form of leukemia, which, while it's a hot natured disease, this person is more earth and water dominant and more in the ignorance factor. And they are a Buddhist practitioner. And I was like, well, the good news is this isn't going to kill you swiftly. The bad news is that you need to actually start to not think that you have too much time to break down your root poisons, and you need to start looking more clearly at your practice, and your luminosity needs to be a little bit shined off so that we can get you ready, because it's going to give you, you're going to get years, not months. And so, this kind of complacency can come through of ignorance, right? Oh, I'm okay. Everything's very steady. Nothing's changing. The blood tests look good. I still have blood cancer, but it's not too bad. So then we're really cultivating this ignorance if you have a nature of earth and water dominance. And so you have to actually unmatch that and say, okay, well, this is giving you the opportunity. This is giving you time. So I really want you to do this practice. I want you to do this practice. And I want you to work on this with your family dynamics. All of those things are preparatory towards allowing the luminosity to come out when that time comes, if that makes sense. So, knowing the nature of a patient or a partner or a family member as they're facing death is really helpful. It's really of paramount importance, actually, because everybody sort of goes through it differently. And so you need to be able to apply those antidotes. So you really do this by knowing how these elements relate and how we're really a part of everything, by paying attention to these root poisons, by looking at our habitual tendencies, and then also just watching how nature lets go. So there's always these beautiful Facebook memes that you see of how the trees are teaching us to let go, but it's actually really true. The trees are actually teaching us to let go every autumn. They're teaching us about the cycle of death. They're teaching us about returning to the elements of the earth, and so on and so forth. And so I think it's really important that people begin to realize that we're so interconnected to nature and these elements that it gives you an idea of where you need more of a particular element to balance out your root poisons more, if that makes sense. There are definitely Buddhist practices which will help each person see their own luminous interconnectedness. And I had said that, a lot of times people are really drawn to wanting to do the very high tantric practices, but their mind isn't stable enough yet because they haven't cultivated shamatha and vipassana enough. So, they might be doing really high level Dzogchen practices, but their mind is all over the place. And so then they need to return to shamatha, which actually is a Dzogchen practice, if practiced correctly, and sort of understand how to stabilize the mind. And that's really, really important. So once the mind is stable, even death can approach and we're unfazed. It's like, yeah, we're kind of bothered. I remember my dad sitting in his chemo chair, and he said, it's kind of not nice because I'm gypped. Everyone in my family lives to be like 90. And I don't know, maybe it was the, Agent Orange, or maybe for whatever reason, but I never smoked, I never drank, I never did drugs. And here I have this disease, he's like, it's kind of unfair, but it's all right. He kind of went through the process of fighting that resistance, and he helped let go by reading a lot of Taoism, and I Ching were really important to him. And towards the last few months of his life, that's all he read. And so he was really going back into understanding this interdependence, and how we get so stuck in the clinging of individualization. And so we'll see also, for example, the Chud practice can really kind of help cut that attachment to the body really well. But if we haven't stabilized the mind, I really try and sway people away from the Chud practice unless they've had a lot of really good teachings on stabilization of the mind and calm abiding. And I remember having a conversation with Thrangu Rinpoche once where he said, what do you think is the main disease and problem with people in the United States? And I said, it's lung, it's wind, it's attachment. And he said, well, what is the antidote? And I said, the antidote is shamatha. And he was like, yes, that is correct. And I said, Rinpoche, I feel bad because I see these people who have been Buddhist for longer than I've been alive, and I keep telling them to stop their practice and just do shamatha. And he said, no, you're giving them the right medicine. And when you're dealing with people who have never been introduced to Buddhism, and they're suddenly faced with a terminal disease, and they're really fighting it, or they're afraid, or they're ignoring it, we have to help them find a way to realize that interdependence with all phenomena, like that they're actually facing this door, that they can, appreciate and say goodbye and do all of the things that they need to do so that they can feel like they can kind of go into this great mystery without really resisting and having those 3 root poisons really solidify in their systems. Family dynamics is so important here, because there will be different family beliefs. So I had a friend who drove to see her grandmother in the hospital, and like the converted Catholic sister was like trying to do the Hail Marys and get the person in. And the other sister was like, don't do that. I don't like that. And it's really important that the person who's dying just be super at peace, that we don't need to worry about their souls or all of that. And that can be really, really hard for certain people. And so sometimes you'll see that kind of family dynamic making the person who's dying have to feel like they have to, kind of make peace for everybody else. And that's really exhausting and solidifies their own root poisons more. So it's really important to pay attention to that and just kind of hang out and just let them be, and sort of talk to the family about how important it is to have a lot of peace and quiet, and just sort of do all the little work behind the scenes with the family, so that the patient can sort of relax without having to feel like they have to take care of the dying spouse or the children they're leaving or the parents that they're leaving, this kind of thing. And so that goes a long way towards really explaining what's going to bring the best comfort psychologically to the person. And then also just explaining to the family what is actually going to be happening for that particular disease. And I find it very important when I'm working with someone who's terminally ill to speak to the significant other or the children or that sort of thing about, okay, this disease is going to express itself this way. The next thing that's going to happen physically is this. When that happens, emotionally, that person's going to be feeling this. So we want to provide comfort in this way, and then let that person go is a piece that we have to like help the family do, because sometimes the family wants to do every last ditch effort to try and let that patient hold on. And so a lot of times you'll see hospice nurses and death doulas being that conduit, that sort of doing that bodhicitta work kind of on the side of really helping the family let go and preparing the family for what the process will look like. So this is my dad. This is my dad when he was in the last couple weeks of chemo, and he was reading the Tao of Pooh, and then he had told me, I think I'm done with this, and I said okay, and he said, I think today's going to be my last chemo, and I loved going with him to chemo. It sounds really weird, but it was this quiet time that I had with him, and I would be working on whatever work I was working on. I remember writing an article about suffering and, the four immeasurables while he's reading, his Tao Te Ching, and we would eat a muffin together. And it was just that kind of slow presence. And I just really remember feeling a lot of appreciation for watching him fearlessly surrender to the process. And about, I don't know, maybe 2.5 weeks before he died, he handed me this passage in the Tao Te Ching, and he said, I'm really, this is where my mind is right now. And this is really important for me to tell you that this is where I'm at. And so you see this passage here, right? The master gives himself up to whatever the moment brings. He knows that he is going to die. He has nothing left to hold on to, no illusions in his mind, no resistance in his body. He doesn't think about his actions. They flow from the core of his being. He holds nothing back from life, and therefore he is ready to die. A man is ready for sleep after a good day's work. And for me, when I read that, and he looked at me and he was like, I'm done. He's like, you need to stop keeping me here, because I was keeping him here. And that was really hard for me to accept, because I could keep him there a little longer, but he was done. He was ready to go. And so that's part of the family dynamics of seeing my own attachment for my own dad in this form, and him saying, I'm formless. This doesn't matter. It's time for me to go. And so that is such a powerful teaching about surrendering to the process versus fighting death. And so oftentimes you'll see people who are really fighting to hang on, and they're really putting themselves through a lot of unnecessary suffering that doesn't need to occur, because death is inevitable. The tumors are everywhere. The kidney life force is up. And I remember saying to him around this time, I said, when I read your pulses before I work on you, it feels like I'm fishing into the depths of the ocean, and I could pull something up and I could get you going for 3 to 5 days. I could give you energy, or a week or whatever. And then towards the end, it was like I would do a treatment, and then it would be like a day later, or even hours later towards the end, where he wouldn't feel like the energy anymore. And I said, your ocean is empty. And so he was like, yeah, I'm empty. I'm returning to empty. And so that was really very important. So at that point, I remember I just turned towards explaining the process to him. And this is a picture of my cat, Mr. Lotus. He was 21, and there he is listening to the Bardo teachings that were on constant repeat for him for the 2 days before he died. And so we can help our patients by recognizing when their surge is happening, their surge of when they're going to be more luminous and awake. This is considered like false qi in Chinese medicine, where people seem like they're, they wake up, they're talking, they're chatted, they want this particular food that they haven't had. And we need to help family members recognize that surge. And I can remember, like with my dad, I knew it was his surge. I said, Dad, today's your surge day. I'm going to get you in the wheelchair. We're going to go for a walk with your grandchildren. You're going to smell the trees. This is going to be your last day outside. And he's like, sounds good. And I can remember my mom being mad at me for putting him in the wheelchair and taking him outside because she said it's too exhausting for him. I said, Mom, this is his last time outside. So, being able to recognize that surge and then taking advantage of it, of instructing them during that time. Okay, this is what's going to happen to your body. Because of this disease, you're going to have more edema. I'm waiting for your kidneys to fail. Once your kidneys fail, then your heart will fail. You have this long. When you start to get cold, I'm going to cover you. I'm going to make you warm. I'm going to make sure that, like, I'm going to check with the pulse ox and I'm going to see that your fire is dissolving. As that's happening, don't worry, I'm going to put lots of blankets on you so that you don't have to feel uncomfortable. So we're preparing them to really understand what this process is happening. And the best time to do that is during the surge. From the Buddhist point of view, we want to do as little medication as possible to encourage that clear and luminous mind. This is not always possible. Sometimes the pain is really great. And so when that happens, if you can take advantage of preparing them for, like, I'm going to give you this morphine. When that happens, you're going to lose the ability to speak. You're going to not be able to ask for anything. I'm going to do the following things to make sure that you're nice and comfortable. Your job is to let go. What does that look like? It looks like when you see mirages of smoke, that this is happening. When you start to maybe have more dreams of dead relatives, that this is happening. So you start to go through the process of all the teachings that you've learned about the bardo, and you're really taking advantage of that surge moment before you're having to over medicate someone so that they can kind of prepare themselves to be as clear as possible. And then if you're using those medications, there are certain points on the body that you can do, or like you tap the top of their head right at the end so that you can kind of bring their mental focus to that. They are losing sensation, but they can still hear you. I can remember my father saying to me, only you can tell me when I'm dead. And when I'm dead, tell me I'm dead so that I know I can leave. And I remember putting my stethoscope on him, watching him take his last breath. I said, he's gone. We need to be very quiet. I instantly called to Nepal to get a hold of Tuku, who did the POA immediately, and by WeChat. And just feeling my father's presence luminously in the room. And then I said to him, okay, Dad, you're dead. It's time for you to finish up everything and go, and that first day I had a dream about him, and he said, yeah, I have a few things I need to do and then I have to leave, but I need you to do this, this, and this. And so, sometimes you can be so immersed with someone's process of death that you literally enter their mind stream. And this is like a practice of Mahamudra. And this is where you and your interconnected nature and their interconnected nature can merge together, and you can sort of understand their experience and you can help guide them. And this can be very important for people who are under medication so that you can help guide them out. And this is when we can do POA practices for them, and we can do something of this nature, and preparing them for that. So again, the cultural appropriation, comfort, having a peaceful environment. This is my grandma, just before she died, just offering those encouraging words of, go for the light. Don't worry if the sounds are loud, and get really close to their ears because, things are kind of moving to the center. So it's really hard for them. And so you also want to do things like mantras which match their nature. So for example, if someone has a lot of aggression and a lot of fire, then we want to do mantras which are more peaceful. So maybe we do Chenrezi or something, or if there's a lot of fear, maybe we do green Tara, for example, because that's really around fearlessness. If someone is more heavy with the ignorance, we might do some Manjushri. Or we might play the bardo, or we might recite the bardo, or if somebody had a particular deity that they were very close to, we might do that particular practice because they were very close to that practice. So there's a way that we can match their nature to kind of help in those situations, so that they have sort of the Buddhas and the Bodhisattvas coming to their aid during that time, because that has the ability to pierce the veil, because the veil is very thin at that time. And so they can absolutely feel and hear that. And that's really important. So we all have heard about the dissolving of the elements, I'm sure, during the time of active death, as one element dissolves into another. So as I stated, it works in reverse formation. So the earth will dissolve into the water and the body's life-sustaining systems begin to shut down. So this is when you will start to see, if the earth can't really hold the water, water will really build up in the system. And this becomes very difficult, and to the point where it dissolves back into fire. If someone has edema, if someone is dying of pulmonary disorders where you see edema of any nature, the transition from water to fire takes a lot longer. And so it can be a very difficult time on their kidneys. And then I often will recommend, if you can, to remove the catheter after the kidneys fail and you see that there is no urinary output. Like when it was my grandmother, I said, okay, that's it. That's her last diaper. I don't just put a chuck underneath her. And they said, well, she's still, and I said, no, you know, I know she has constipation. I know she still has stuff in there. Just leave that alone, because every time you move her with her broken hip, it's really painful and I have to give her morphine. So I just want you to just, you know, leave her. And so you can watch the body for that, and you can remove the catheter if you can, because you don't want the mind's attention to go to the lower holes. As we know, we want to go to the upper orifices. Best would be the top, of course. So I think it's really important to watch when that water dissolves completely into fire. Sometimes that can move quite quickly and sometimes quite slow, depending on what the disease is. And then as fire dries out, the person will be very cold and they won't really be able to communicate that to you very easily. And so it's really important to really pile the blankets on to make sure that they're not uncomfortable. And then this you can watch very carefully with like a pulse ox, because their oxygen levels will start to drop. And then it gets to the point where you can't get a reading of the pulse ox on the fingers, and you can't feel the death pulse down on the top of the foot. And so you know you're quite close at that point for it dissolving into wind. So then when the wind starts to go, the whole body will cool. You'll start to feel a lot of cold on their skin. And then as they take their last breath, that's when the wind elements dissolves into the heart. And then hopefully we're leaving through the top of our head and we're entering into the space that's the bardo. So that's when we can recognize the clear light. So it just works in reverse of our formation. I'm going to go, let's see, what time is it? I'm going to go kind of quickly through what you've probably received as teachings before, but the earth will start to deteriorate the harder or solid parts of the body. So people will stop having stool movements. They're already quite emaciated often and weak and fatigued, and they can't really think very clearly. Sleep is a place where you start to see people making that transition to the other side, and the fatigue assists in that. And then internally, they're starting to have like dreams foreshadowing their death, like riding backwards on a horse. And there's very specifics that are given within the tantras. Or you may start to see loved ones that have passed on speaking to you. And this is like a mirage in one's mind that they're creating as they're getting closer. And that's when the earth is starting to dissolve. This can happen for weeks at a time. And these mirages can develop into inner visions that one might have as they pass through the rest of the stages. And so it's just really important to recognize that it can happen for a very long time, for weeks at a time. The second stage, the dissolution of water, again, this can take a while if there's a lot of edema in the body or pulmonary situations. And there's definitely a decrease in all of the fluids of the body. The tongue dries out, it becomes very black. The urine is extremely dark. They don't sweat anymore. And then they will have this vision of smoke internally. The third stage, the fire, is when it's moving into wind. And as I described, that coldness retreating from the limbs into the center of the body, pulls inwards as the life-sustaining wind starts to shorten. And of course, people are no longer eating or drinking at this point. They're done with that. And they may not recognize people. They don't really have a concept of who's in the room and who's not. Sometimes if someone's a very fire-natured person and they have a lot of aggression and they're very uneasy and they're fighting death, this can be a very difficult stage for them because they're recognizing somehow that they're not really breathing properly, and they will have that apnea, or that death rattle will really be quite pronounced. And the reason that the fire, especially, as earth and water is dissolving, a lot of times you'll get that kind of death rattle in the throat, and you'll get a lot of heavy mucus because it's trying to dissolve, and the fire itself is already diminished. So the dissolution of fire at this point, they kind of lose that rattle of the phlegm in the throat. It's a lot more dry, so you can sometimes watch at that point, because sometimes, like, you might have to suction someone during the earth and water stage, but during the fire stage, that's dried up. So everything kind of dries up everywhere. And they will have internal visions with sparks that kind of come with smoke. And then that fourth stage is really when the wind is beginning to dissolve. This is at a very close, it's very close typically between fire and wind, happens really quickly. The person is definitely unconcerned with worldly activities. They're probably not really paying attention too much to who's in the room. And of course, they don't taste, or they don't recognize textures. They don't have a lot of sensation for their skin because the wind is responsible for sensation on the skin. And so internally, they're sort of experiencing as if there's this fluttering of the fire going out, or like the lamp or the candle flame dissolving. And then we have what's known as like the 5th through the 8th stages, or we're really kind of moving rather quickly into the subtle aspects of dissolving into the clear light when wind dissolves into space. This can happen very quickly. People can go into the bardo very quickly and then immediately start, almost within hours to minutes, begin to make a transit into a new incarnation. Yes, it can take up to 49 days. It typically takes much less time, unless you've had a lot of preparatory practice for recognizing the clear light. And this is, of course, externally when we have no breath, no movement, no heartbeat, and no memory. So this was at the point, like for my father, when I watched him take his last breath. And then my mom asked me to check. So I put my stethoscope on him and I said, yes, he's gone. And then, she just wanted some quiet time with him. I wanted to do the POA. So I did the POA. And then I remember he had requested that I not, he said, I want you to do all your Buddhist stuff. And I said, okay, don't worry, I will. And I went out and I sat outside of the house until I felt him leave. And then I went in and I checked again. And that was when his chest was completely cold. Nothing was left, because when the consciousness is still there, the heart space will still be warm. Or like in my grandmother's case, when she took her last breath and they all came running in and they wanted to, check her and do all the things for the time of death. I said, don't touch her. Please leave her alone. I have a few things I need to do religiously. And they can't really say no to that. And, I didn't get as long as I did with my father because she was in a facility and they have to record the time of death. And they just said, tell me what the time of death was. So that's, again, the preliminaries where you can talk to the family. You can talk about the importance of this particular moment where the outer breath has ceased, but the inner breath maybe hasn't fully ceased. And it's a really quick cessation of going into the subtle. And so it's really important to be very quiet during that time. This is when the POA can be performed, and then really waiting until there's full coldness in the chest. And so that the consciousness has completely gone. And we want that to happen before we start to mess with them too much. And so, they will go into the bardo and they'll go through a series of looking at the different appearances where, there'll be subtle stages. The white will then turn to red and then to black. And so there's a lot of teachings that you can have around that in terms of bardo teachings and entering the clear light. Of course, if you're Buddhist, this is something you cultivate your whole life, preparing for this point. But I think if we're just interacting with people who are not as clear with that, or the family members may not be so familiar with what their Buddhist dad wanted, for example, then we just really need to remind them to give that space during that initial time when this sort of stage moves really quickly and that fifth stage is happening all the way through. So that's really important. So I mentioned Mahamudra. The practice of Mahamudra can be done with a dying person, and it can be extremely helpful to sort of enter into their mind stream a little bit and unify and understand the vastness that's happening to them in that process. And we don't have any attachment to it. It's very luminous and very clear. And it's, it's an unstained state. And so if we can practice Mahamudra, it helps us to sort of understand what the process is and sort of merge with them a little bit so we can feel what they're feeling and recognize the states as they transition. And that can be really helpful. So this is a picture of my dad. This was on his surge day. This was the Sunday that I took him out, and I said we were going to go for a walk, and he was in a wheelchair, but he climbed 14,000 foot mountains and was a big gardener. So I just wanted him to go see his garden one last day. And so I just wanted to end my teaching with that, thanking my dad, because I'm approaching his 1 year. I'll land in Nepal the day before his 1 year, so I'll be able to go and do his 1 year practices there, and I'm really grateful for that. But I also remember that when he got sick, and I had the turmoil of like, why does it have to be the one disease I can't do very much about? And I said that to him, and he said, well, because it's going to make you a better doctor. And so I have to just thank him for those heart teachings, because I watched him go fearlessly to death. And I love this picture of him. It's the last selfie he ever took. But the thing I love about it is how luminous his eyes are. So I just want to say that as we're facing death and we're facing formlessness, it's completely possible to do so without fear. So that concludes my talk. If I can figure out how to exit the screen. And then I will take any questions that you have.
The first one is, and a couple of people asked this, people want the name of the text that you mentioned from the third Karmapa.
Rangchen Dorje's, I think I loaned it to a friend, or I'd go grab it. It's his text on, it was put out by the Nalanda, it's a restricted text. It was put out by the Nalanda Translation Committee. It's his text on the subtle body channels. I'm trying to remember the name of it in Tibetan. I loaned it to someone for something, and I don't think I have it on my shelf at the moment. But it was put out by the Nalanda Translation Committee, and it's Rangjung Dorje's text on the subtle body. But I think you have to get permission to have them give it to you, which can be done. You just have, like, your Lama write permission if you've received certain teachings.
Okay.
I can look for it and get back to it, get it to you so you can release.
Thank you. That would be great, because when we send out the recording, we could include the name of the text.
Yeah.
Thank you. Then there's 3 others so far. First one is, I've witnessed people in the process of dying who were given morphine and were able to function, speak, etc. Please clarify that those who are administered drugs for pain may still remain lucid until the end. And please comment on how the mind's clarity is restored following the end of the outer breath.
So that's awesome if that happens. It takes a lot of practice to have the mind be that clear. I think it depends on the amount of morphine that one is taking. Certainly morphine can cloud the mind a little bit. In my experience, I have not seen a lot of lucidity with a lot of morphine. But I think it is possible. I think anything's possible. And I think some of that has to do with people's mind state going into it. And the mind, once it's released, well, it's not even the mind, really. It's your law. The law, some people translate law as consciousness or soul. I hate the word soul because it has a weird connotation to it. But it's the law. It's this, it's part of the wisdom wind that is kind of temporarily housed, and it leaves the body with that last breath. So oftentimes people's mouth are open. And so that's a very frequent place that people exit, is through their mouth. And it's like kind of hard to get their jaw to close. You should never force it, for example, but once the mind is freed from the house, really, it's like a bird. So it can enter into this luminous state very easily because it doesn't have the trappings of the body. And because the body is mingling with those 3 root poisons on a physiological basis as Lung, Tibetan, Pagan, and the 5 elements, once it's freed from those 5 elements and it's freed from the 3 root poisons temporarily, it has a place to go. And so it goes into the bardo and it goes into luminosity rather quickly and easily. So it will regain some sort of perception because it's not obscured anymore. It doesn't have those skandhas and those heaps that are keeping it from having clarity.
Okay, thank you. Please discuss the inner breath and how it differs from the outer breath at death, and what happens with the consciousness in the interim.
Okay. The inner breath, so again, this is related to the karmic wind versus the wisdom wind. And so when we're looking at the destructible and indestructible nature of Tigli, of consciousness and mind, the inner breath really gains that freedom once it's freed at the time of death. And so the outer winds are really sort of kind of unnecessary at that point of death, because the inner wind has freed itself. Outer wind and sort of the sort of karmic nature of things, there will be a seed that carries itself with it, but it's not going to have the same impact at the time that your consciousness is freed. So whatever you have culminated in the life that you have, the outer and the inner winds kind of dissolve together, and then you're sort of freed at that point. And so the wisdom wind sort of goes with you and goes with that consciousness. And the karmic wind is finished, it's exhausted. So it doesn't have any more space until you reincarnate, if that makes sense.
Okay, thank you. Do you find that OCD fears and tendencies are related to lung?
Oh, yes, 100%. 150%. Yes. And anyone who's had trauma, shock, if they have nervous system disorders, if anyone has had any kind of abuse, like this kind of thing, then it's going to be more pronounced. And so for that reason, the vast majority of people that have that kind of quivering fear and kind of obsessiveness at the time of death, it's going to be really hard for them to settle. And so it's really important for them to like have a lot of calm, like again, that warm oiling massage on the hands and the feet can be something that can be really, really helpful. There are wind points on the body. One is on the sternum. So if you, I always say if you have perfectly perky nipples, which nobody does, so it's right in the center of your sternum, or you can look it up. It's a Chinese point as well. It's called REN 17, RN 17. So this is the point of the Karnak song. So the Karnak song, when I showed that image of the 3 main channels that sometimes people do with the 9 purification breathing, so we're accessing the wind, the bile, and the phlegm, or the lung, tipa, pagan, right? So we can access it through the nose, through breathing, and each of these innervate. So one here, navel, and then below. So those are the 5 chakras. And so when you're talking about the Karnak song, Kar means white, Nak means black, Song means point. So this is the meeting of the white and the black channels right at the heart. And so this point in particular can really impact when wind is out of control and very intense, and it influences both the other 2 root poisons, and it kind of calms down that kind of anxiousness. So like a warm oil with like nutmeg and ginger, and even like just a little bit of black pepper can really calm down the nervous system. I will make like it actually comes from a Mongolian practice called horme, where we actually make a compress that we put on the wind points to calm it down. So it's warm, but you can make like a little essential oil with like frankincense, myrrh, nutmeg, caraway. Make sure you have enough oil in there because nutmeg's quite volatile. So the warming tends to calm down the wind, especially during time of death. And so you can put it on that point. You can put it on the top crown point. You can put it on the 2 occipital points that are in the back. And hands and feet are mini corlos, mini chakras as well. So if you do that, that can really calm down the wind. And I highly recommend doing that. I gave a lot of massage to my grandmother in the days that I was with her. Yeah.
Thank you. Here's one that says, I have heard that it is best to not move the body for 3 days if possible. Have you heard this?
Oh, yes. So we do death astrology, which will tell us, like traditionally in the Tibetan system, we'll do death astrology pretty much right away. You don't want to touch the body because the inner winds are kind of still sometimes working for people who have done a lot of practice. This really doesn't happen a lot for the ordinary person. We're pretty much out of there within an hour or two because we've already moved into the bardo very quickly. When we've cultivated a lot of practice, it can take a lot longer for that inner wind to finally leave, and because the consciousness is still kind of doing stuff. So there are lots of stories of like the 16th Karmapa, for example, who when he died in a hospital, he had no heartbeat, he had no breath, but his chest remained warm for a long period of time. So that's when the inner winds are kind of still doing their thing. And so most people are not going to last 3 days. Most people are going to be a few hours to a day at the most. So if you can, and it's very hard to do, you can get death astrology done, which will tell you which direction from what door they need to leave, and what particular practices need to be done within the 49 days. That's the main important point, and that's the main thing that can be done even if hospice and the mortuary has come and taken the body. You can still have a really good impact by doing the death astrology. And so you know exactly what practices they need within the 49 days to help them make their transition. And then oftentimes, you know, you can, with very high lamas, they might remain in tukdam or in that inner wind state for a very long period of time, or even high practitioners. And so you don't touch them because they're busy. They're very busy. And that's why with my dad and with my grandmother both, I was like, hands off. And I kind of wanted to make sure that they were gone before we even called it in. And that's the advantage to dying at home, is that you can actually give a few more hours before, you know, rigor mortis will set in and all that sort of thing. So you can actually allow for some timing, and that allows the inner channels some time. 3 days is not like a hard and fast rule. It can be extended for a very long time. People can stay in tukdam for like weeks even. Yeah.
Is there a way to prepare someone who has dementia and has lost memory of their practice?
Oh yeah, that's tough. I think the best way is through hearing for recognition. So using like a recording of whatever was their main practice, if we know what their particular deity was, using a recording of that particular deity, which will probably connect them more. Or if they had a particular teacher that they were with, if there are recordings of that teacher giving teachings, that would also probably help pull their mind stream back in a little bit easier.
What is your Tibetan medicine perspective on death with dignity, euthanasia? Also, how do you support someone making that choice, and how do we support them in the process of their death?
That's a tough question, because according to Tibetan Buddhism, if you end your life before your karma has dictated it, you don't get to finish out that karma, which is tough because sometimes suffering is immense and it's really hard to do. So like in the instance of my cat, who was 21, he would have been euthanized long before. I understand it from an emotional point of view, because sometimes the suffering is so great, it's hard to imagine wanting to continue. But from the Tibetan medical and Buddhist point of view, you want to actually embrace the suffering of your death if you can, because it allows you to transform and transmute the karma that illness brought you. And so it's a real tough card to play, but that is the actual viewpoint. And then I think the second part of the question was, how do you support someone making that decision? You just love them, and you just offer compassion, and we don't try and put our own Buddhist point of view on someone, like, oh, well, you won't get to finish your karma, so you're going to come back and you're going to have this disease again. Like, that's not useful at all. It's not helpful. So it's more important to be helpful for, what are your wishes with your body? What are your wishes for your family? How would you like this to look? It doesn't mean that you're enabling or supporting or even creating their death, but it just means that you're offering them love. And loving kindness is a form of compassion. So I think it's really important to just offer that kind of love, that unjudgmental love. It can be really hard to do, but I think that's really important.
Thank you. Can lung diseases be inherited intergenerationally?
Yes, there is a certain amount of, so we have 404 disease categories. And so there are some that are genetically inherited. So yes, like ALS is like the perfect example of that, actually. So ALS can be passed on intergenerationally through your genetics, and it is a wind disease. Dementia is another example of a wind disease, and that can be passed on as well. Yeah. And some of that you could attribute a little bit to the karma of embodying in that particular family.
Okay. Will chanting Om Ami Dewa Hri to Amitabha Buddha be useful at this time?
Absolutely. That is probably the primary mantra to use for people to help detach themselves from their form. It's the main mantra that I would use for anyone who's non-Buddhist as well. Yes, very helpful. Yeah, I have a Kempo friend that's the first thing he does, is that particular mantra.
What oil do you use for the warming? Is it sesame?
You can use sesame. Sesame can be heavy if somebody has edema. I usually use apricot kernel oil, or avocado oil is even a little heavy. Grapeseed oil. Olive oil we use. Butter. Tibetans use butter.
How will obstructive sleep apnea potentially affect the process of our dying?
If you have sleep apnea, then you're already starting to have that dissolution of the elements on some level. And so at the time of death, it will make it a little faster. It'll move it forward a little faster. So the death rattle will come quicker. Yeah.
And then I imagine many people would like to know this. Is there a way to get physical copies of the screens that you shared with us?
I mean, sometimes I put things up on my website, or I have stuff on ResearchGate or academia.com. I hadn't really planned to put this up, but I think you're recording this, yes? So
yes.
Yeah, so you're recording it, and is this going to be something that you have on your permanent share, whatever your
Well, everyone will receive the recording and they'll be able to watch it for 3 months.
Okay.
And then eventually we hope to make a more permanent type of video with it, but I'm not sure when that will happen.
Yeah, so I think eventually if you do that, they'll have that. I'm not as likely to share a lot of Buddhist teachings publicly, like on my academia and that kind of thing, just because I don't want people to have misconceptions about certain aspects without the teachings behind them. But I will give you permission to rewatch this and take screenshots if you like. I would just ask you not to use them without attributing them to my name is the only request. So, but you're welcome to do it that way.
Thank you. And then there are a couple of questions about where a person can train in Tibetan astrology.
You must know Tibetan very, 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 very well. Oh, I didn't pay so much attention in my astrology classes. It is tough. The Tibetan astrology is really hard. So there's two tracks of medicine. You study for 5 years to be a Tibetan doctor, or you study for 5 years to be a Tibetan astrologist. The only place I know to go to study to do Tibetan astrology would be at either the Minsi Kong in Lhasa, Tibet, or Minsi Kong in Dharamsala. I don't know if there's a tract for SIPA's, SIPA is the title for an astrologer, in Varanasi, or if they just do medicine. I'm unclear on that, actually. It's a 5-year study. There probably are some classes. There are some very talented astrologers in the United States. There's one in California that I tend to send people to. I don't know if he teaches classes, however, also in Bhutan. You can also study at the Royal Academy of Medicine in Bhutan, but all of those you would have to pass the entrance exams, which requires a lot of knowledge in Tibetan grammar. And yeah, it's kind of tough. There are a few books out there on Tibetan astrology, but if you want to become adept at death astrology, it's probably unlikely unless you're going to dedicate probably about 7 or 8 years of nothing else but that to your life, if I'm really honest. Otherwise, I would make friends with a good astrologer. And in every monastery, there used to be a Tibetan astrologer, or some of the Rinpoches can do it. So if you're looking for someone to do like regular death astrology kind of thing, I would try and find in which monasteries do they make that offering, and then try and get that sort of line of communication open so that you can make that as an offering for the people that you're working with. I don't mean to sound discouraging. It's just not really out there in the world yet that I know of to study it very easily. Yeah.
We have just a few more questions, but I think we're going to need to stop taking questions. We're running out of time. Here's the next one. The last place to touch is the crown. So how do you check for warmth at the heart center if it's not best to touch anywhere but the crown?
So in the case of my father, I wasn't worried because I also did a particular needle in a point to open up all the gates of consciousness. So that's how I did it. But really, that's the problem with people touching. So after I read the stethoscope, I went back up to his head and I tapped. And then if they have hair, you pull the hair as well. But if there's no hair, then you just tap right on that point. So yeah, it can be an issue when medically people are rushing in and reading it and calling time of death, and there's all this kind of, intensity. If someone dies in an accident, for example, that's why having POA done for them can be quite important, because they might have had a lot of like medical tubes and things interacting with them that can be very distracting as they're trying to leave. And so in that case, having someone perform POA can kind of go over that and act the same as touching the top of their head.
What are the inner winds accomplishing in the period after apparent physical death?
They're either finishing some practices, or they're just kind of coming to the acceptance of death and trying to sort out where they're going and trying to figure out how to get there.
With our last breath, is faith in our teacher and root guru enough?
I would say yes. I would absolutely say yes. I always say that when I die, I'm just going to put medicine Buddha on top of my head. I want to go hang out in his Pure Lands for a while before I come back. I need to get some more teachings. So yes, because your guru, your root guru, is the expression of all the Buddhas and the Bodhisattvas. he or she is directly like related and connected to the mind stream of all Buddhas and Bodhisattvas. So having faith in your connection to them helps bind you and propel you forward in a good karmic position for your next life. So absolutely, that's a wonderful thing to do. Totally, totally appropriate.
And the last question, which I'd actually, with your permission, like to address before you do, because I have some information. The question is where and how to learn POA. So I just wanted to mention that Chaktu Kadro gave incredibly wonderful teachings on POA, including the empowerment, which you need to have, either a Chenrezig or Amitabha empowerment, that TLC has on DVD that you can purchase with a donation from us. There are both teachings and a practice session. And so that is a little boost for you in terms of learning POA, but many teachers teach it from time to time. And that's all I would say.
Yeah, I would just like to caution that if you're newer to Buddhism, that it's not a practice that you try and learn right away, because there are many highly skilled POA masters who can also help. Because again, I'm sort of, you might notice I'm the shamatha cheerleader. But I really sort of feel like it's really important to cultivate a base practice before learning POA, because you can do some harm if your mind is not really ready to do that practice. So it's important to seek a qualified teacher of POA. So certainly the one that you're describing is really supremely qualified. So I just caution people to not do the practice too much without guidance, because once you do open the top gate, then you need to stop doing the practice, because then you can actually decrease your lifespan. So it is actually something to be practiced with caution.